Yeah, I've started the meeting with that classic mistake of keeping myself on mute. Apologies. Okay, welcome. I can see there's lots of people still joining this event. It's so exciting to see so many of you joining us today. My name's Della, and I'm one of the AHP Associate Directors for the Trust. My background is as a speech and language therapist in intellectual disability. You're all very welcome. We're so pleased to see you, and the engagement for this whole event has really been phenomenal. Hopefully some of you will have been on Connect today and been able to look at all of our pages and information, and I'm sure some of you will have noticed that it's missing some of the content that you've all been sending in, because we've been overwhelmed by the contributions that you've been sending and doing with us. Don't worry, it will all be there as soon as we can get round to it. So, you know, nobody will be missed out. It's just that we're just so pleased that everybody wanted to be involved, and we want to be able to showcase everybody's work properly. So the themes for AHP Day 2021 are about celebrating our AHP family, who we are, what we do. They're about appreciating us, what our skills are, and what the impact AHPs have on care. It's also about inspiring, so inspiring people to become AHPs, inspiring people to go on AHP career journeys and really develop the future leadership for AHPs. And then the last sort of key driver is connecting. And for this event, this is about connecting across professions, across directorates, across divisions, but we also want to connect widely with a wide range of AHPs, including those from diverse backgrounds, because being part of the AHP family is about including everybody and everybody belonging. So when we look at the Trust, we've got about 700 AHPs in AHP registered roles. So those are roles that people are specifically required to do for their training. We have our best guess just over 300 clinical support workers. Why we're guessing is that there are very, very many naming conventions across the whole of the support workforce. So it's really difficult for us to pull off who's who and who's where. So I suspect we'll find there's a lot more than 300, but that's our starting point. And also there's a whole range of allied health professions who aren't in protected ring-fenced allied health professional roles. So they might be doing a role that's open to registered staff. So a nurse could have applied for that job, or an AHP, or it could be any of the AHP professions that do it, not specifically ring-fenced for an OT or a physio, for example. So this event is for everybody, all of those groups of people, and of course all the colleagues who AHPs work with on a day-to-day basis. And it is a celebration event. So we're going to hear from our board members. So we're going to hear from our chair, from the executive director of Nurses, Allied Health Professions and Quality, and also from our CEO. There's going to be the opportunity for you to ask questions and hopefully for us to give answers. Where we don't know the answers, please be assured there's no such thing as a silly question. There's no such thing as a too complex question. And if we can't answer you today, we'll do our very best to get back to you as soon as we can. And we'll be closing the event with a really exciting live prize draw. So you'll know that we asked for nominations for AHPs and clinical support workers that we want to appreciate and to acknowledge and to celebrate their achievements. We've had, at the last count, 45 nominations. And so we're going to be doing 2 prize draws to randomly give out those appreciations. But we will also be posting on the website all the names of all the people and the reasons why they were appreciated. So that will be there on our AHP pages. So without any further ado, I'm going to hand over to our panel. If I go to Suzanne first, just to introduce yourself, Suzanne.
Good afternoon, everybody. So, Suzanne Avington, I'm the Interim Associate Director for Allied Health Professionals here at the Trust, and your Deputy, of course, as well. And I'm a physiotherapist by background, for those of you that haven't yet met.
Okay, thank you. And Paul, would you like to introduce yourself?
Hi everybody, Paul Devlin, Trust Chair. Really delighted to get to spend a bit of time with you and to be absolutely doing that, celebrating and appreciating AHP colleagues. And I'll say a bit more about that in a little while. Thanks.
And Anne-Maria?
Hello everybody. My name's Anne-Maria Newham. I'm the Executive Director of Nursing, AHPs and Quality. I'm very proud to have AHPs in my title. I think Dr. Brewin isn't yet on the call, Della, so I don't think we can go to him just yet. So if you want to carry on, and we'll go with the flow, as they say.
Okay, well, really, it was to hand over to yourselves now, to Paul, yourself, and John, to really give us the a few lines about what AHPs, about priorities for AHPs, or any pearls of wisdom, or anything that you wanted to say before we open up to a wider Q&A. So, Paul, did you want to go first? Thanks
very much, Della. And yeah, just a few reflections, if I can. And first of all, there's over 100 colleagues on this call already, which is fantastic. And I just want to say, first of all, thank you so much for everything that you do for the people who need our services. I know that this last 18 months has been so incredibly tough. And for you as AHPs, I know that you've had to work in some really challenging circumstances. I was with some colleagues of the community stroke team earlier today, and just that stuff that we now take absolutely for granted, of having to do all of the stuff that you do, but doing it in full PPE, is a real additional challenge. And it was great spending some time with Emma, Michelle, Catherine and Thea this morning, and being able to be with them, with some of the patients and carers who you support. And not only was it great for me just to observe kind of compassion, skills, that work at relationships, that care, also the ambition that you have for the recovery journey of those you work with, whatever that means for them. That shone through really strongly. And one of the things that I took away as well was some really clear feedback from carers and patients about how much they value the kind of contributions that AHPs bring in. So that piece about celebrating and appreciating is really helpful, Della, getting some numbers at the start there, and actually recognizing that across so many different roles that we kind of bundle up into AHP, actually there's a mass of skill, professionalism, and real important contribution to the care that we give as an organisation for those who need our services. And as Anne-Maria said, it's really important that AHP is in her job title. It's an important piece of the picture for us at board level. And I know that Anne-Maria is an absolute champion for all of you when we're having conversations at board level, and we really do work hard to make sure that we are thinking about you in the midst of all of the different multitude of decisions and conversations that we're having. So I think I'll pause there for a moment, Della, and perhaps pass across Anne-Maria to yourself to say a few words. I have spotted that Emma's put a question in the chat bar already about how do we make sure arts psychotherapies, AHP professions don't get lost when people leave their roles? And I'm sure that potentially is something you'd want to assure over other roles as well. But I don't know if you want to pick that up straight away, or just give us a bit of an intro from yourself, Anne-Maria.
Yeah. So no, Emma's posed a really good question there. But before we launch into how we make sure that AHPs are considered, valued, and not part of the good old SIP that we've seen in the past. I just wanted to say over 120 people on the call now, and I just wanted to say how fantastic that is for us. We did it virtually last year, and it was really successful. I wasn't sure if it would work, and Della was like, "Yes, we can do this," and I was like, "Oh, well, I'm not really sure," but actually, it went really, really well last year, and we were so confident to do it again this year because of that success. And I think we've made the point that actually it's a little bit more accessible from people because you're all scattered all over, not just Nottinghamshire, but we've got services in Leicestershire, Rotherham, Lincolnshire. We've got services all over the place. So that accessibility is really, really important. And I think it shows that we've got over 120 people on the call. And I wanted to say to you all as well is that, I am a massive advocate for AHPs. I've benefited having AHPs as part of my portfolio. I think that for me, I've been lucky in my career to have AHPs alongside me that have shown me the way. They've given me a good advice. They've supported me. It's been a very, very good relationship that I've thoroughly enjoyed, but I've also learned a lot from. And I remember the very first time, it was about 2000, and I was told I was going to line manage all the AHPs in a service, and I remember thinking, what do I know? But at the end of it, it wasn't that long. After about 6 months, they all said to me that you're definitely an honorary AHP, because I'm, when I advocate, I really, really do advocate, and that's what's important, because you all have such a massive part to play in the recovery and treatment and the journey of all the patients and families and carers that we have. So I know that, and it's my job in the board to make sure that the rest of the board understand and know that too. And it's it was great that the organisation also supported some of my business cases. So that's how we were able to get a deputy AHP. That's why we've been able to do a little bit more work around the apprenticeships. That's why we've been able to put in 2 clinical academic AHPs, which is amazing because we haven't even got one for nursing. And I have to say as well is that, nurses have always stood on the stage and had a big kind of backing. But actually, AHPs have got just as much right to be on the same stage. And that's what this is about. This is about saying we value your contribution because we know that it makes a massive difference. And I got the lovely email from Paul, who'd been out with the physios this morning and was allowed to stay to see some input into the patients. And he did. It came straight back and said, "Oh my goodness me! What a difference! What compassion, caring." Really motivated, and really lovely to see that input that you all make every day to our patients, carers and families. So my bit, I have to say to Della, you go and do what you need to do, Della, and then come back to me when you get stuck. Come back to me when somebody says no to you, and that's exactly how we work. We've got it off to a T now because she's really good at getting through all that red tape. But every now and again she'll come back and say, "This is just not working." And we recently had one around a dietitian, the work that dietitians do in respect of menus and making sure that the analysis is correct. And she says, "Honestly, Anne-Maria, we need something in this." And I said, "Right, okay." And we were stuck. We were absolutely stuck. But like I said, that works well if I kind of have the right information, the right push, the drive, what we do need in place. And seriously, it goes really, really well for us in this organisation. We've got a good reputation. We've got a good reputation in the system. And Della has always been a real big part of that system voice. And I think that makes a massive difference. I've just seen Elizabeth, because Elizabeth gave me a hard time as well. I've just seen her there. But yeah, we can get through this. We can do these things together, because together we can do anything, really. I feel anything. And if there's red tape out there to be had, then let's cut it. So with much further ado, I can see we've been joined by our illustrious leader, Dr. Brewin. And I'm going to hand over to him now to just do his little bit, just to say thank you.
Thank you.
And sorry for being late. I'm having a bit of a day, as I'm sure many of us are. Hello, everybody. John Brewin, Chief Executive. And sorry for being late. You know, when you've been away from your computer and your phone for a few minutes, and there's like lots of messages saying, John, where are you? Sorry. And I do sincerely apologise for missing the start. But I did hear Anne-Maria's address there, and I just say I couldn't agree more in terms of some of the things that she was saying, and just a couple of reflections from me, really, in terms of where AHPs are and the fabulous services that you provide. I remember talking to Della back at the beginning when I first rejoined the organisation, saying, "Come on, you hide your lights under a bushel. It's there's so much brilliant care and input going into a huge range of service users and people that use our services. Let's really celebrate and get it visible." And I really sense that we've made some good progress on that over the last couple of years. There's always more that we can do, but in terms of the visibility of AHPs more broadly, I think it's come on hugely. In terms of my reflections from having previously been a clinician and a psychiatrist, I am always full of admiration for the skills that AHPs can provide, not least within a mental health and learning disability domain where my work was. And I know that's only one particular area, but just one example, we ended up sort of in the, I don't know, late 80s and 90s with another period of austerity, and there were no AHPs to be seen. All the wards have been stripped of physios and OTs, and everyone was scratching their heads thinking, well, why aren't patients recovering and getting discharged? Because they had nothing to do and no one to help them. And it was a really obvious thing. And I think, again, we started to really address that now, and hearing about the whole pathway of career, from encouraging people to pick up these roles to develop, but also to develop the more senior roles within the AHP world, to lead teams and lead wards, I think is really important for so much of the work that we do. So it's really great to be here. In terms of my introductory bit, just want to finish before the next bit to say thank you to you all. Do appreciate that the last 18 months has been a heck of a challenge. One of the reasons I'm a bit behind myself today is we just had a listening event for the system, from staff from all walks of life, feeding back to the senior team from the cold face, if you were, about the impact of the pandemic on their desire to run high quality services. And it's been it was a really good session, but really challenging to hear some of the real difficulties that every day all our staff and volunteers having the challenges, whether that's in emergency department, whether it's in the community, in our community teams, or our mental health teams. And I know all of you are involved in that as well. And we've all got our own personal challenges of the pandemic to manage, haven't we, in terms of juggling roles and staying safe and not being able to have the routines of our normal lives. So I really appreciate everybody's desire to remain professional, committed, and to do the best thing for our patients. So thank you, everybody, for everything that you do day in, day out. So that's my intro done. Who am I handing back to now?
Well, we'll just hand back to myself. Thank you so
Della,
much, John. Yes.
Sorry.
Thank you, John. Thank you, Paul, and thank you, Anne-Maria. That was a lovely introduction to our afternoon. So it is over to yourselves now for questions and hopefully some answers. As I said, no silly answers. We have had some sent in to us, but also we have got the question from Emma that we can start with, that's in the chat, and Suzanne's going to be all over everyone's hands, checking if anyone else has got any questions to ask after this. So Emma's first question was, what are our trust aims in making sure that arts psychotherapies and other AHP professions do not get lost when people leave their roles?
I'm not really sure where to go with this one. Right. So I suppose the best thing that can happen when anybody leaves, and this was back to my point earlier, my worry often used to be when people don't value a role and they don't understand it. So one of the big things that we've done recently, and we did a brilliant session with some of the art therapists, was to really start to help the board understand what the role entails and what the contribution from that important profession is. And actually it really helped some of the non-executive directors to think, oh, hold on a minute, this is brilliant. This is exactly what we need to be hearing about. So I think there's not one answer to this. It comes at it from lots and lots of different places. Number one, you have to talk to the actual divisional director for that area. And ensure that, because of course they are the ones that manage their operational vacancies, recruitment, they look at skill mix, and they ensure that the budgets are in line. So the conversation is to be had with the divisional director, but also it's about, that presence, making sure that people understand it. And that's where the board can come in, the senior managers can come in, people like me present papers and reports to the various committees to say, this is what these people do, this is how fantastic the work is, this is the difference it makes to patients. And that's a job that I have. So I think you come at it from lots and lots of different angles to ensure that somebody doesn't take that away and think there's a cost improvement. I'm not sure if that's the answer, but I think that you come at it from lots of different places.
Could I just chip in, just building on the piece about the board space, just to say that recently at the board, we had a patient story from a patient who's in part of our high secure services, and he spoke really clearly to us as a board about the positive impact he'd had from art therapies. And one of the things he said, and was putting in absolute plea along the lines that Emma had put there. And one of the things that really struck me was he said that he felt that having access to the art therapy work in part helped him to be able to come off some of his medications. And I thought, he was bringing that perspective in, and it did feel to me there was a really holistic piece there. And I think, I'd certainly support us really trying to do that tracking of who's moving where and the possible impacts of that. But I can see John's got a hand up as well, so I'll pass across to John.
Yeah, thanks, Paul. I bumped into. I think she was a music therapist on our Council of Governors the other day, who saying similar things. I just wanted to just say a little bit more about the points put in the chat. And it might not feel like it yet, but the NHS long-term plan has actually through mental health, learning disability, and some community monies too, actually secured one of the largest funding increases for our services. I'm saying in a generation, it's way above inflationary pressures, and it will take a little bit of time to sort of filter through to the front line, but I think it will change a lot of the conversations. So we won't be scrimping around trying to just nick posts here or reduce the banding there. I think we will truly be in a space where we can really start to develop the sorts of specialisms and many of the services that you provide, and so that we can get to where we need to be to meet the patients and service user needs within our teams and our communities. So it's a relatively unusual position to be in, but it's an exciting one, because I think this is the sort of thing that we'll get away from, so we don't lose half a music therapist there, or the dietitian has to be shared with 17 different teams, and we can really start to build truly multidisciplinary outfits. Thanks. Excuse me, I've just got to take a call. I will be straight back.
Okay, Suzanne, I'll hand over to you.
I was just going to add another aspect to it, really. I think as well as having those crucial conversations with your divisional directors, I think it's about sort of them understanding also what your other colleagues in other areas, what they can contribute, but equally where they might not yet be skilled. So actually there aren't too many assumptions are made about how a dietitian works in one division compared to another. So it's absolutely about sort of, it's not suggesting that our colleagues can't do a role, but it's suggesting where the differences are. So I think we all have a sort of responsibility to sort of help educate everybody about that also.
Okay, now I can't see any other hands up, but we did have some questions. Sally,
a hand there from Sally.
Yes, Sally, over to you.
Thank you. It was just thinking about the sort of need to have more AHPs in lots of different roles, and that sort of supply pipeline, I suppose, of professionals. We've obviously got lots of exciting opportunities with degree apprenticeships coming along, but I know it's quite challenging to make those offers equitable across the trust, and to really have that sort of trust-wide approach to supporting that. So we've got physio and OT apprenticeships, degree apprentices, I know already. We've got speech and language therapy coming. We've got lots of other opportunities, but it's really, really difficult to get the funding sorted for the backfill and to really make those opportunities appealing and accessible across all the divisions of the trust. I wondered if there are any thoughts about how we might be able to take that forward.
Anne-Maria?
Yeah, I think, Sally, you raised a really good point. So one of the pieces of work, which I don't think we do shout about an awful lot, and Della is quite good at this. So over the last 12 months, myself and Della have become aware of jobs that are being advertised that says nurse only. When we've looked at the job description and we've looked at the person spec, there's nothing in there that says, you know, why you would have to just be a nurse. So one of the things that we've done is we've challenged our colleagues, and we've gone back to HR to say, actually, we need it taken out. The advert needs to say clinical professionals. And really interestingly, recently we need a clinical lead, a clinical quality lead for our subcontracts, like the Priory and places like that. And one of the things that we've done is we've made sure it doesn't say nurse, it just says clinical quality lead, because what we recognise is that could be an AHP as well. And also Becky, I can see Becky Sutton's on because she's a massive advocate for AHPs, being one herself, is that we put out adverts now that say head of nursing and AHPs, which we've never done before. So Becky recruited 3 heads of nursing and AHP roles. 1 was a nurse and 2 were AHPs. So we've done a very different, over the last 12 months, we've really tried to turn it on its head. And we're having those conversations with recruiting managers to say, tell me why it has to be a nurse. And if you cannot give me a really good explanation as to why it has to be a nurse, then it has to go out as a clinical person. I don't know if that helps, Sally, but that's certainly what we've been doing.
Paul?
Yeah, just to, I mean, I think Anne-Marie has given a really good solid answer to that. And I think that piece about us being really clear about what we mean by some of our language. So I've certainly at board level with things like the recruitment of non-executive directors, when we use terms like clinical background, we need to be really clear that we mean that in as broad a spectrum as possible, because I think sometimes historically in the NHS we've used terms like that to be really narrow. So us being explicit about how we include AHPs and that massive range of AHPs as well within some of that description, I think is an important part. But I'd say, Sally, I'm sure if there are times when you think, oh, actually, it feels like we've been missed out a bit on this one, that's exactly the kind of thing that Anne-Maria and colleagues would be really interested in getting to hear about, because we don't necessarily get it right on every time in every case.
Thank you. I can see we've got somebody else with a hand up.
Becky, it's Becky.
Becky.
Hi everyone. Just to add to that, really, in terms of, I think the other bit of it is about that workforce planning element. So actually, you know, I think at Notts Healthcare you've got a huge opportunity around how we could make really attractive roles for our AHPs across the diverse areas that we've got. And I know me and Suzanne have had many chats about how we can do this a bit more creatively. So actually, you know, we do know out there, putting adverts out, particularly in community teams around therapies, occupational therapists. Actually, we are all pinching from the same pool if we're not careful. So it is about how we can attract people, keep them, and actually, as Anne-Marie has talked about, have a career path for AHP. So we've done quite a lot of work, or we're starting it in community services, about how we can do that. But what I do is, I think we should encourage how we work cross-divisional for that, because actually, you know, as an AHP student, whether that be a physiotherapist or an occupational therapist, there's so much we could offer as an organisation, and so much breadth and depth that people could see. So I suppose it's about what's our unique selling point to our students, to our apprenticeships, and all those routes that we grow our own. You know, and I feel really humbled. I started off as a training audiologist at 16, and wow, I never quite imagined I'd be here now. But I think, you know, it does tell our stories. You know, you don't have to be a medic to get where you need to be, and I'm really proud of my clinical background. So I think there's lots of different ways we can do it, Sally.
And there's a lovely comment from Anne-Maria there that you're amazing, Becky. So Suzanne. Thank you. I'm just wondering if that's fully answered your question, Sally, in terms of apprenticeships. You know, and what we need to be able to do to sort of harmonise that maybe across some of the divisions. I think linking back to some of the great conversations that we've already started around our workforce planning, and like Becky's described, really, it needs to go right back to that point, I think, doesn't it, in terms of what's available to us and what can we be making best use of at the moment. I know we've tried to do it in particular areas, but I think it's in each of the divisions that we're now trialling it, to keep taking that back to people, culture and inclusion meetings, discuss how we can use the apprenticeships and how we can learn from them, and share that across, perhaps. Thank you. And then if I just stay on for a moment, sorry, Della, Sally's just come in with a question commenting on one of the, it's great to hear about how the roles are open. Sally, I don't know if you want to take your microphone off and ask your question yourself, or I can read it out, more than happy.
Hi there, sorry, I was just trying to work out how to turn it off. I was just thinking about, you're talking about the increased kind of range of roles that are open to AHPs, and thinking that that's fantastic. It's good to know that there's broader career opportunities for us, but how do AHPs know that those roles exist and feel kind of empowered to take them on? I think the other thing as well for a lot of us is that we want to be able to use our specific professions, skills and training, and, you know, to know that we would be able to use those within the kind of roles that you were talking about.
I'll say something on that one. I think you raised a really interesting point there, Sally, about maintaining your professional kind of like identity, the element of, and I think this is a really interesting one for me, because there came a point in my career that, you know, I stepped away from what I'd trained in, what I was, and it was a really difficult decision for me to make. And for about 6 months, you think you can go back, and then after a year, you realise you can't go back. And I think that comes to all of us, depending on what we go into. If we go into like management, or if we go into like operational management, sometimes you have to make that very difficult decision, that's the decision you make, and that you're going to go into that way. And I know what you mean by, because nurse consultants hold on to their clinical and can still progress, although in this organisation we've got very few nurse consultants and they're only at an 8B level, and I think that there isn't really anywhere to go to maintain, apart from into things like clinical director roles. And certainly across organisations, I've seen a lot of clinical directors be AHPs, and in fact I know that we've got Rebecca Keating, who's really, really good. And is a very, very good advocate for kind of like the clinical director role. I think she is somebody I would aspire to say, actually, anybody can be a clinical director. So I think that it is limited. I can't deny it. It is limited at a senior level. But I think that with regards to the exposure, how do you get to know about it? That's just those conversations and networking and what's going on over there, that curious element of it. So whilst I haven't answered your question, I understand where you're coming from. And I think there's a little bit more thought for us as an organisation to help AHPs to be able to work into that. And with regards to that, feel empowered, I think look to those people that are now in senior positions, like the 2 heads of nursing we've got, like Becky, like people like that. They are all there, and they can show you how you can do it, really, how you can step into those roles. John, help me out. Answer it.
You're beyond help, Anne-Maria.
I know.
But no, it's a really good question. I think the first part about is a communication thing, and I think our communication engagement with staff across the organisation again is improving. It's a lot better than it was, but this is perhaps a good example of where we need to focus more specifically on making sure that whether it's certain professional groups or geographies feel more connected and part of the organisation. So that's a really good challenge. I think the second point is more broadly about career progression. So I know it's easy to criticise doctors for lots of reasons. I can, because I am one. But the career pathways for medics, I think, is a good example of how you can do both, because there's sufficient flexibility in the career pathways that, so for example, when I was medical director in Lincoln and chief executive there, I could still do clinical work, and I was really proud to be able to do that, because you know, that's one of the values that's really close to my heart, and that's why I do the job. But there aren't very many other professional groups that have that flexibility in their career pathways that enable people to continue to do clinical in its broadest sense of the word work. It's important that within the executive team we've got, I think, a really strong background in the execs of people that have come from the clinical world. But I think more broadly, it's something that, again, that we need to work on, and particularly with our organisation, as Becky was saying earlier, you know, we are broad, we are diverse, and we should be able to describe career pathways that enable people that want to get into management, into leadership, to continue to do the clinical work that's got them into this sphere in the first place. So a really good question. Thank you.
Thank you. And picking up on Paul's point that in the chat, this is something we're working very hard on to sort of describe the career journeys. And if you go on our Connect pages and the Inspire section under the AHP Day, we've got quite a few, and we've got some as well from last year to hear about the different paths people have taken, because there's not one linear path to an AHP leadership journey. It's very wavy and curvy and goes in all sorts of directions, and so it's really important. Have a look at those. They are definitely inspiring. Yes, Paul, I agree. It is very important that we do keep our best staff. It's tragic to see us losing sometimes some of our great staff to other organisations, and such a waste of our investment in them. I have another question. Jenny.
Yeah, hi. I just want to ask, because I love the discussion, but I was just thinking, because I've been talking to a lot of clinical support workers, AHP support workers, obviously thinking about the nominations and the stuff we've been doing for the AHP Day. And I think I'm hoping quite a few are on this call. So really it was just to have that chat about CPD opportunities, because I know there's the apprenticeship routes, and that's not always the right route for people, but just that kind of the trust approach to kind of opportunities for skill development and progression for our support workers.
To be honest, Suzanne would probably be the best person to answer that than us execs. Suzanne, are you all right to answer that?
I am. That's CPD opportunities, Jenny, wasn't it?
Yeah.
And for our support staff.
Yeah.
Yeah, so we have struggled for a long while in terms of the WDF funding and the CPD monies that we know aren't for our own registered staff. But what we are doing within learning and development at the moment is, I understand, looking at how we can use some funds to actually pull together a series of sort of really relevant courses for our support staff, to actually sort of I suppose test them out first and foremost, you know, how they meet sort of their competencies in terms of not just so much clinical, but they're sort of advancing their career and developing them. And we're really keen to get involved, and hopefully there'll be more information to follow later this year actually about piloting some of those courses for our support staff. So, and that will absolutely include nursing and AHP clinical staff. So more to come.
There's a lot more to come as well from the Health Education England a funding project that will be carrying out across the next 6 months. There's a lot of work coming from Health Education England on competencies for clinical support workers and career structures and how we help people meet those. So I'm really hoping that we'll be able to use all of those resources and tools to come back into the learning and development, and sort of make sure we've got aligned offers for our own clinical support workers. And as Suzanne said, it's incredibly relevant for HCAs as well. Another question?
Oh, another hand. Oh, I've got Alice.
Hi everybody, I'm loving the conversation so far, thank you. Mine's not so much around workforce actually, it's a bit more about service design and contracts. So I read lots about prevention, and we're hearing lots and lots about how important prevention is in particularly around our ageing well agenda. And AHPs, we're really good at this. You know, as physios and dietitians, we keep people strong, we keep people on our feet. Our occupational therapists keep people moving and safe. Our speech and language therapists are preventing admissions, looking after people swallow and helping them communicate their needs all the time. But somehow our service specs and our contracts don't quite allow us to fulfill that full potential. How do we move that forward so that we can be really sticking to the evidence base and really improving people's quality of life?
John?
Go on, I'll start then. Hi Alice, nice to meet you. What a great question. If anyone's got the answer to that, can they drop me an email? That is the holy grail, isn't it, of what the NHS and social care would love to be able to do. And we've been having these conversations for a very long time about whether you use the various terms of less shift or moving to a much more preventative early intervention agenda. But the way the NHS particularly is built is completely against achieving that objective, because as you know, that the money goes into the big acutes and for people that are already ill, and it's like a big money pit magnet. And those of us that are a bit more enlightened about the benefits of early intervention and community inputs and care close to home and all the things that you describe, a relatively small shift in the funding to really develop these sorts of services would have a huge impact. But finding the bravery, the political air cover, the resourcing to move that is really difficult. And there are some places in the country that are perhaps a bit further ahead. But it's one of those really frustrating things, people like myself, that it makes so much sense, isn't it? But to be able to actualize that is really tough. So I didn't mean to be too dismissive by saying if anyone's got the answer, let me know. But it's a great,
John,
it's a great
that's
question.
not the answer I want to hear. I hoped it was just in your back pocket, ready to come out. Ta-da.
I'm optimistic about the potential of the integrated care systems. They're not going to be the answer to all our problems, but they do provide us with the opportunity to for a bit of a reset about building from the bottom through properly formed primary care networks and place to build upwards and to review some of the very traditional services that we've got. So I'm a travelling optimism, and a sort of call out, to people on the call, if you want to get involved in those conversations and you want to contribute to how you think you can move it forward and you've got evidence base to back it up, then please get in touch and get involved. Thanks.
Della, I know you want to move us on, but just on the back of that piece, Alice, really great challenge, thank you. And I was just going to mention, I think, John, there's something in there that we need to be able to take into some of the conversations with our partners in the integrated care system and actually put some challenge in there. Because we are, Elizabeth has put in there about prevention, health promotion, public health, looking at some of that, those wider perspectives. And we are starting to get conversations like that. But I think, Alice, your challenge there about actually let's find some resource to enable us to take the skill sets that we've got in our AHPs into some of that solution is a really good one. So I think that's one that we need to take away, John. Thanks very much, Della.
Thank you. Becky?
Thank you. So I have a glimmer of hope on the horizon, and I haven't got the answer, but I have got a glimmer of hope. I'm leading the Community Services Transformation Programme at the moment, and they're exactly the conversations that we're starting to have. So let's stop focusing on service specs. Let's focus on outcomes and actually do the right thing and spend our money in another way. And I've just nearly completed 5 system workshops around what that could look like. So I think there's a couple of opportunities that I'm going to plug here. Coming soon, probably in the new year, as workforce and members of staff, you'll be invited to be part of that design, that local implementation about how we're going to keep our places and our neighbourhoods working and how we redesign community services. So I think that's a great opportunity, and I think if we put the staff at the forefront of that transformation, and guys like you, Alice, and others, then actually you can really influence that, because I think you need to be in it. And I think what I am hopeful is commissioning will move to more of an outcomes based focus that really will focus on health outcomes and health inequalities. And I think unless we do the prevention stuff, as well as working with voluntary sector organisations, local assets, and and having a workforce wrapped around a neighbourhood, we're not going to manage the demand in the traditional way. So I am hopeful, and I think, you know, as I say, watch this space, because I am hopeful that you guys will get involved in those conversations in the new year. You absolutely will, in terms of helping to plan some of that destiny and what needs to happen.
Thank you, Becky. Okay, Suzanne, I don't know if you wanted to add anything to this conversation, because I know it's a topic close to, well, both of our hearts. But then I'll leave it to you to move on as well to the live prize draw.
Okay, no, absolutely. Just one final comment, really, because I'm just keeping an eye on the chat in terms of there's lots of comments and lots of hearts and thumbs going up here. I think my one observation and listening to colleagues is that people don't always feel necessarily involved in those conversations, and in terms of there being permission to be involved, I think people are looking for that maybe a bit more than we have at the moment, and maybe we need to sort of really strengthen that in some of the teams and services, so that AHPs are having an opportunity to really get involved and not making an assumption that it's only maybe a couple of AHPs that need to be. For me, I think it's the whole raft of our really diverse group of AHPs that can make such a big difference to that agenda. Okay. So I think you are staying on me, because I have got probably one of the loveliest jobs to do this afternoon, which is recommending all of the nominations that we have had for our AHP Appreciation Awards. So as you know, we've been busy on our Connect pages. Hopefully everybody has had chance to take a look at that. All the nominations for the AHP Appreciation Awards are now on there, and I would urge you to have a little look at those. As Della's described, we've had several nominations, and we've had them for a range of categories. We actually chose 8, ranging from AHP student and preceptee to AHP leader, AHP innovator, and AHP support worker, which we're particularly proud to sort of be promoting this year. So in the absence of not being able to obviously draw from a hat, a tombola style hat, in true game show host, I am going to share my screen with you and take us to an automated spinning wheel. We are going to draw 2 lucky winners, just very randomly, and we've chosen to celebrate one registered AHP and one AHP support worker as well, because we have had such an influx of nominations for our AHP support staff. So in the inevitable, bear with me while I share my screen for you. Right, I'm really hoping someone's going to shout out and support me and say, yes, we can see your screen, Suzanne.
We can see it, yes.
Yeah.
Fabulous. So first up are our AHP support worker nominees. And as I say, please do take a look at the Connect pages, because you'll read some fabulous stories about them. I'm just going to click on my wheel. Can you see it? Naomi. We have Naomi Clifford as our winner. Jenny, would you be able to, is Naomi with us at all, I wonder?
Yeah, is that Naomi out there? I mean, just to share, because there was lots of lovely, beautiful comments, and people put lots of effort into their nominations and wrote lots of beautiful things that were hard to capture. But I just want to share that. So Naomi had a couple of nominations actually, but we had a lovely quote from Sadie, who's one of our nominators, about how she joined the team in the midst of the pandemic and made it her mission to learn, develop, and improve the therapy provision on the wards. About Naomi being one of the most caring and empathetic people that they've had a privilege to work with, and that inquisitive minds are developing interest in research to question inequalities in healthcare. And just about absolute supporting of patients and a professionalism in hard work, and how she's influenced the team ethics. And so she's deserved everything that she's achieved. So well done.
Oh, congratulations, Naomi. Okay, so I'm going to just close that one down. Bear with me again. And this next one is for the remainder of our nominations. Start the wheel spinning again. Ooh. We have Hannah Bond.
I don't know if Hannah's
there. It's my right hand woman. Have we got Hannah with us?
Hi, I'm here. Hello.
Oh, lovely.
Oh, hey, Hannah. Congratulations. Well done.
Thank you very much.
So I'll just embarrass you. Just give me a minute. Just again, lots of lovely comments, really. But I think Lisa told us that when the pandemic first occurred, that you stepped up to this clinical lead role and as a diabetic foot MDT, and you virtually had no notice. And it was a challenging time. You quickly adapted with a very high risk patient caseload to ensure that patient care was delivered in the most safe possible way, and that you've made difficult decisions about whether patients needed to attend for face-to-face or could be cared for at home. And just that you took it all with great aplomb, and that that you deserve a massive well done for stepping up during this enormous challenge and being very supportive to the whole MDT.
Oh, I'm blushing now. Thank you very much.
Oh, that's fabulous. Thank you so much, Suzanne, for organising that. And thank you to all of our nominees. Everyone is, of course, a winner. But we do have those two. You do get a choice of a voucher between Amazon or a book token. So we'll be in touch to make sure you get the choice of what you want. We're really getting very short of time. Suzanne, did you want to say anything more about awards or?
Well, I mean, I think just to stress, really, please go and have a look. The nominations were incredible. And I think for me, whilst we had 45 nominations, some of those nominations are part of teams. So it's actually sort of 70 staff members names that we've heard about. So, you know, absolutely, our colleagues have had an awful lot to say about one another in terms of appreciating their team members, their leaders, their managers and their support workers. More than anything I can really sort of pick up on, really. So yeah, both awards justly deserved. And I suppose just, you know, in the style of actually it's quite easy to nominate, or it's not too bad to nominate people. Don't forget the Oscars have just opened, so what a great opportunity to think, actually I could really nominate a colleague. And indeed, even throughout the year, we've got the Health Services Journal, there's lots of other sort of uni professional organisations looking for nominations throughout the year. We're more than happy to help craft any of those stories with you. Please get in touch with Della or I, and we can help you in any of those applications. But it is such a lovely thing to do for staff. And as they say, nothing ventured, nothing gained. So why not?
Yes. So that's one of our ambitions for the next 6 months, is to help as many people put through some nominations for awards at all different levels, because we really need to celebrate. And remembering what John said right at the very beginning, you know, that we mustn't be hiding our what's the expression anyway, hiding our light under the bushels, lights, bushes,
light under your bushel,
light under your bushes. Thank you. Okay, so I'm just going to say thank you to Suzanne for that. I'm going to say a very quick thank you to Jenny and Jordan for being behind the scenes on today. And I can assure you that without Jordan and Jenny, this would not be happening. So that's important. Obviously, thanks to our execs for joining us. I'm going to hand over to them to just give them the chance to sum up. But don't close down too quick, because the very last thing that we're going to show you is our premiere. So get the red carpets out. It's a montage showcasing AHPs at Notts Healthcare, all part of our AHP family, doing what we do best. And it's only about 3.5 minutes long, but it's an amazing piece of work that Jordan's put together for us all to share. And we're going to be sharing it really widely after this event through comms. So Paul, shall I go to you first? Have you got anything you'd like to add? Or
really quickly, just to say again, thank you everybody. This has been a really great session, hearing about just some of what you're up to, but also those great suggestions and challenges that came through with the chat. And I think I'm looking forward to more conversations like this. Thanks very much, everybody.
Thank you, Paul. And John?
Hi, I'd echo that. Big thanks to everybody. And if I could be a little bit cheeky and please don't forget to fill in your national staff survey forms. Only takes 15 minutes, totally anonymous. Your feedback matters. Thank you very much.
Well, I'm going to say, can you please have your flu jab? Because John does staff survey and I do flu. No, honestly, this has been I've really enjoyed it, and I've enjoyed it as much as last year. Honestly, these are brilliant events, and you know, like I said, to have over 130 people in a room all together like this is just amazing. And there is so much to celebrate. There's so much, and I loved the Wheel of Fortune. I loved it. I don't know where you got that from. That is an amazing thing. So. I don't know, it's just been nice. It's been really warm. It's made me feel inside, you know, we've got some great people working for the organisation. I've really enjoyed it. Thank you so much.
Thank you. Thanks very much, Anne-Maria, John, Paul, Suzanne.
Yeah, thank you to everyone for joining us. Happy AHP Day. And just to follow on to John's theme, I'm going to pop an evaluation form in the chat. We'd be really grateful if you wouldn't mind spending a couple of moments just letting us know your thoughts. And AHP check-in, of course, as well, on the theme of keep doing things for us. But if you have a few moments to let us know how, what your thoughts are, that would be really valuable. Thank you very much.
Yeah, thank you, everybody. It's you're all real stars, and we appreciate you all. And now I'm hoping very much that Jordan's going to play the montage for you, and we can really see how we all belong to a Notts Healthcare AHP family.